May is Mental Health Month, and we want to share some resources that can be used to diagnose and treat a variety of mental health issues. And one of those resources is Community Care Services based in Lincoln Park. And joining me this morning is Jill Blackson, the Deputy Director for Community Care Services. Thank you so much for coming on. This is such an important issue. First of all, is there still a stigma, you think, with mental health concerns?
Yes, I believe there is a stigma. People tend to feel shame about their mental illnesses, and we don't want people to feel shame about any part of their overall health.
How prevalent are mental health problems in the state of Michigan, for example?
Well, the statistics show us that it's approximately about 1 in 5 people are suffering from some sort of mental illness, whether it's depression, anxiety, or something like bipolar.
What are some of the most common symptoms or signs?
Well,
Red flags.
I think what starts to happen is maybe someone's behavior starts to change pretty dramatically. They may start to isolate themselves more, may start to kind of withdraw from activities that they normally would be participating in.
And they have difficulty making decisions? And
sometimes, yes. I mean, it depends on the mental illness that they're dealing with. There's a lot of different symptoms, but usually just something is different than their normal everyday behavior.
And thoughts of suicide is certainly one of them?
Oh, definitely, definitely. That is a symptom of some severe underlying depression.
So if family members notice these changes in a loved one, what should they do?
Well, just like you would with any other physical illness. If you're having some symptoms, you want to go to a doctor. You want to seek help. And that's really what we want people to know is just like you go to your doctor to treat any other kind of physical symptom, we want you to treat your mental illness like you do your physical illnesses and to take that shame off of yourself.
So what are some of the opportunities you offer for people at Community Care Services?
We offer outpatient treatment and a number of different services that fall in those. So anyone can call us up and we can get them an appointment and speak to somebody about some of the things that they're experiencing.
I've heard some people say, you know what, we want to help our loved one, but they don't want the help.
Yeah, that
How
is a
do you
challenge.
handle that?
I think you just have to keep encouraging them, keep reminding them that they don't need to suffer. If they are experiencing some really, real strong anxiety or real severe depression, that this doesn't have to be where it stops. You can get help. You don't have to suffer. You can feel better, just like you do if you have a physical illness. There's treatment for that.
But legally, if they are over 18, you can't haul them in somewhere.
No, just like you can't maybe drag your brother, your sister, into the doctor if you know there's something going on physically. You can't do that for mental illness until it becomes something extremely severe. So that is a challenge. So I think you just have to keep encouraging, bringing materials home, education home, and saying, hey, I care about you, and I don't want you to suffer. So let's go talk to somebody.
What's the biggest misconception about mental illness?
I think people tend to think it's this crazy person running around, doing all these dangerous things, and that is the very rare occurrence. Most of us know somebody who has suffered from some mental illness in their own lives, if it's not our own issue, whether it's severe anxiety, social anxiety, postpartum depression, things like that. So I think we just have to understand that most people know somebody who has suffered from some sort of mental illness.
And treatment is not just, say, taking a pill. It can be a variety of treatments.
Absolutely, absolutely. It's about treating that whole person, their physical health, their mental health, and medication may or may not be a part of that. Some behavioral treatments may be a part of that as well.
Diet,
absolutely,
sleep.
Yes,
I mean, it really
all of those
can be diverse.
Yeah, all of those contribute to our overall health. If we're not getting good sleep, it'll affect us.
So important. And where can people go for help?
They can call Community Care Services, 313-389-7500.
Thank you so much.
Thank
It's such
you.
a pleasure, and we appreciate everything that you do in the community.
Thank you.